Okay, so I'm going to do the Sbar for this patient. This is my end of shift report. He is a Mr. Juan Manuel, 64-year-old male. He was admitted yesterday with CHF and COPD exacerbation. He is a patient of Dr. Smirka. He has no known drug allergies and he's full code. He has had COPD for several years, but was recently diagnosed with CHF. He has had a persistent cough with a green sputum. He's become increasingly weak and tired, and his ankles have been swelling. He's had difficulty sleeping, lying down because of the cough, and his daughter finally brought him in yesterday after he could no longer tie his shoes because his ankles are swelling. He has since been diagnosed with pulmonary edema, and he has a 20 gauge IV in his right forearm. He is alert and oriented ×4. He speaks little English, mostly Spanish, so you do need an interpreter when you're doing your assessment and speaking to him. His last vital signs were 98.9 degrees Fahrenheit, temporal temperature, pulse of 100 beats a minute, and it was a regular, strong pulse, 26 respirations, and his blood pressure was 100/80, and he is on a nasal cannula with 2 liters nasal cannula, and his O2 saturation is 93%. He has decreased lung sounds in his bases, and he has wheezes and crackles in his upper lobes. And he has his pedal pulse was +1, and he had +2 pulmonary +2 edema on his legs and his ankles, his pedal +2 edema in his pedal ankles. His abdomen was round and soft. He had bowel sounds in all 4 quadrants. It was non-tender. His last bowel movement was this morning. He is voiding on his own with clear urine, yellow clear urine. His grip is weak, bilateral, and he's got weakness in his lower extremities as well. And my recommendations would be to continue to monitor and assess for CHF and COPD exacerbation, and review the orders. All right.